Thank you.
Perfect. Thank you so much for welcoming us here today. We're really excited for the opportunity to speak with you all and chat a bit about choosing wisely and what we're doing as medical students through the STARS program. So our presentation is called Choosing Wisely from the Start, Implementing Choosing Wisely Canada Principles into Medical Education. And my name is Vivian.
And I'm Kayla. And we're both, like Jason mentioned, second-year medical students at the University of Saskatchewan.
Slides.
Let me check.
Oh, sorry, we just have to pull up the slides. So this is kind of just an agenda of what we'll be speaking about today. So we're going to start with just a primer of what choosing wisely is for anyone who needs a bit of a refresher. Maybe this is new too. Then we're going to chat about choosing wisely principles in medical education. And then we'll chat a bit about our choosing wisely USask group and what we're doing at the University of Saskatchewan to engage trainees. And then just a little bit at the end, just about future directions for the STARS trainees program and implementing choosing wisely recommendations into medical school. Okay, so we already introduced ourselves, but here is us again. We are the STARS representatives at the University of Saskatchewan for this year. And interestingly enough, Kayla and I both hail from Regina. So I have a biochemistry degree from the University of Saskatchewan.
And I have a biology degree, concentration in cellular and molecular bio, and I did that at U of R.
And this is our team at the university. Some of our teams, is about half of the groups that we have at the University of Saskatchewan through kind of our STARS or our Choosing Wisely USask student group. So the four of us on the left are based in Saskatoon, and our one lone member on the right there, he's our member based in Regina. So he takes on quite a lot of the responsibilities with integrating kind of the programming and things we do through Choosing Wisely to also have that at the university or the Regina campus as well. Okay, so we're going to start just with a bit of a primer on what Choosing Wisely Canada is. I understand most of you are probably familiar with this, but just a bit of a refresher just to kind of introduce what we're going to be talking about later with how we're integrating these concepts into medical education. So Choosing Wisely Canada, it's a national campaign that aims to promote resource stewardship in healthcare. So of particular interest, topics like microbial stewardship, using clinically appropriate imaging and laboratory testing, opioid prescribing, blood transfusions, and even environmental sustainability for resource stewardship as well. So what Choosing Wisely Canada offers is lists of recommendations within medical specialties that offer suggestions for ways to reduce medical testing and prescribing and using evidence-based medicine to kind of decide when tests and treatments are warranted and when perhaps they are not. So this is an example of some of the Choosing Wisely recommendations. This is 6 of the top 10 Choosing Wisely international recommendations. So things like not imaging low back pain within the first 6 weeks without red flags, not prescribing antibiotics for acute mild to moderate sinusitis. So things like this, where there's opportunity to decrease the use of unnecessary tests or treatments when they aren't actually evidence-based or warranted. And here are just some other kind of pamphlets that Choosing Wisely Canada might have up in doctors' offices, clinics, or things like that, just to help remind physicians of when to use these appropriate treatments and diagnostic tests and when perhaps they aren't warranted. And what's interesting about these as well is they also tie in the conversation with patients as well, because patients often come in with expectations to appointments for testing that might not be warranted. So these kind of both remind the provider and the patient to just think about evidence-based prescribing and when things are actually warranted. So this is a bit more about why choosing wisely is important. So we've talked a bit about what it is and what it aims to do, but why is this something that we need within our healthcare system? So a 2017 report by Unnecessary Care in Canada found that up to 30% of medical tests, procedures, and treatments may be unnecessary. So that's quite a lot of interventions, tests, things like that, that might not actually be necessary for patient care, might not optimize patient care and things like that. So there's a lot of room for error there and ways that we can. Oh,
You said I should
sorry.
call.
Is there a question?
Not very far. He's got the insulation in now.
Oh, I think someone might have their mic on. That's okay. Okay, I think we're good to go.
Perfect.
So there's just a lot of room for where we can kind of cut down on this unnecessary testing to both optimize patient care and optimize our use of medical resources as well. So here's some examples. This is from a Choosing Wisely Canada 2022-23 report of just some opportunities and places where we should maybe consider why we're doing the tests we're doing and opportunities to potentially kind of cut down on unnecessary tests and treatments as well. So, and you see in the left-hand corner there, 24 to 31% of patients with lower back pain without red flags received diagnostic imaging. So they didn't necessarily need that imaging done, but it was done all the same. 42% of Canadians with a cervix aged 18 to 24 reported receiving a pap test in the last 3 years. And again, that wasn't warranted. And even if you look in the bottom left-hand corner there, just the volume of antibiotics that are being prescribed, which is something we want to pay attention to for kind of the health and safety of our antibiotic use. So this is another slide just to kind of show how there's room for improvement in this as well. And this kind of ties in the conversation with patients and care providers as well. And this slide kind of demonstrates patient attitudes and thoughts about Choosing Wisely Canada and how they see the use of their own medical treatment and how well optimized the tests and treatments that they're receiving are. So about a quarter of Canadians recommend a test or treatment by a doctor that they didn't feel was necessary. And 62% of Canadians agree that there's a significant amount of unnecessary health care in the system. So it's important to kind of tie in patient perspective in this as well, because both sides can see that there's potential for improvement here as well. And it's also important to tie patients into this conversation, because in the bottom right-hand corner, you can see there, it says 42% of participants said they expect a prescription or a test when they visit the doctor when asked about personal expectations. And that can be a lot for patients to have that kind of expectation coming in. Can be a lot for a provider to deal with, especially if you have a limited time. So tying in patient perspective, educating patients and providers is also something that's important in this conversation as well. So the other question, we understand why this is perhaps important and why and where there's room for improvement in these. But does this actually work? Does Choosing Wisely Canada promote any kind of change in the healthcare system? So this is something that we've pulled from the Choosing Wisely 2022, a 7-year update. And so since launching in 2014, Choosing Wisely Canada has over 450 recommendations within 90 subspecialties. So quite a lot of recommendations that have been kind of made collaboratively in many different specialties. And here's just some stats from that kind of reflection year update that showed how Choosing Wisely Canada recommendations are being used and the impact that they're having in actual healthcare systems. So at Toronto's University Health Network, they saw a reduction in 8% in CT rates after 16 months after implementing Canadian CT head rule checklist and Choosing Wisely Canada patient handouts. At the Vancouver Coastal and Providence Healthcare, they saw a reduction in low back pain imaging by emergency room physicians. And again, that was after implementing Choosing Wisely Canada recommendations for low back pain imaging. And at the North York General Hospital in Toronto, they saw a 31% decrease in the numbers of tests ordered after updating their order sets to Choosing Wisely Canada recommendations. And what's really profound about that particular update is that this resulted in $157,000 savings over the course of a year. So these are just a few examples, but as we can see, implementing these recommendations and using evidence-based medicine to decide when something is warranted versus unnecessary can both preserve the health of our healthcare system and also ensure patients aren't getting tests and treatments that they don't perhaps need.
So now I'm going to be talking a little bit about STARS. Jason mentioned our involvement in this already. It is students and trainees advocating for resource stewardship. It has no connection with the STARS helicopters, although that's a question we get asked a lot. Basically what this is it's a campaign within the 17 medical schools across Canada, whereby a few students across each school are elected by the Choosing Wisely representatives and the vice deans of our schools. And we essentially work to compile ideas and share our projects with everybody, all the students across Canada. And excitingly, next week we will have the opportunity to, I guess on Saturday, we're leaving to go to the national meeting in Montreal this year. So we're going to be talking about our involvement there as well. This was an award, it's called the Superstars Award, a little bit of a funny name, that they give to a few of the STARS students across schools to come and speak and meet in person and have a discussion with a variety of speakers across a variety of disciplines, which is very exciting. We're looking forward to that. So this is not us. Hopefully you can see my pointer. I'm not sure if you can, but this is Jessica and this is Jaden. They were last year's STARS students, and this is them in Toronto at the annual meeting. So they were there presenting their projects, and we have kind of inherited many of their ideas, came and implemented them, and then obviously we're going to discuss about what we have implemented this year as well. This is the whole group of them, again in Toronto here. Jessica and Jaden are here on the left side. Here on this side, I really hope you can see my pointer, otherwise this doesn't make any sense, but this is Dr. William Silverstein, or Billy. He's an internal medicine doctor over at the University of Toronto. And this is Tara Goodale. And together, oh, perfect, thank you, Jason. Got confirmation, you can see the pointer. Billy and Tara Goodale are our STARS representatives through Choosing Wisely, so they are who we communicate with, deal with directly. And now here's us. We have not yet had the opportunity to meet in person, so we were very excited coming the 14th to see everybody in person. Right now we meet by Zoom, and we do these meetings about every second month. We discuss with everybody. So these are all the STAR students from the 17 medical schools. We discuss and share ideas. We talk about what's been going well, what hasn't been going well. We share tips and tidbits for getting more engagement, compile like questions or different resources we can share. And so it's a wonderful opportunity to communicate with everybody with a similar interest. Again, you can see here's myself and Vivian and Billy and Tara. We're trying to do the C and the W for Choosing Wisely. As you can see, many of us are backwards. So we did try though. All right, and now I'm going to talk about resource stewardship and medical education. This is really our focus and what we aim to implement with our STARS projects. Is what we have currently sufficient? And unfortunately, we don't really think so currently. The topics of resource stewardship are mentioned, but they are rapidly glossed over. And this is fair. When you're a new medical student, it's hard to choose wisely about different options when you're still learning what those options are. So we respect that this is a process. It can't come easily and it won't come fast. But we're hoping that these Choosing Wisely guidelines can get implemented more readily into the education so that people are more familiar with Choosing Wisely Canada guidelines and know where to search for them if need be. Right now, there are mentions of the Choosing Wisely Canada guidelines throughout our curriculum, but it's inconsistent and it can be hard to find them. There's a mention in our syllabus for our clinical course. There are links to specialty-specific guidelines in our orientation lectures for modules. So say we're starting cardiovascular or we're starting obs-gyne. We are reaching out, this is part of our work, we're reaching out to the module directors to get those Choosing Wisely guidelines in those lectures. There are some mentions by individuals personally interested in their own lectures. So they might bring up, say, in MSK, talking about back pain imaging and talking about how you shouldn't be getting x-rays unless you are really concerned there is like a neurovascular problem, that kind of thing. But otherwise, they wouldn't be there. And finally, they are rarely integrated into clinical cases, but it does tend to be more of a like aside bonus, can you get this, rather than the focus of the case. So that's where we're kind of hoping that we can make some turnarounds in the near future. Here's a picture that I took of our syllabus. This is our syllabus for the clinical course that we have. So the one where we go and do much of our like learning about systems, pathologies, treatments, that sort of thing for a whole host of diseases. This syllabus is about 40 pages long. So here's one page. And I wanted to point out where the Choosing Wisely Canada recommendation is. And there it is. So you can kind of see how, if you aren't specifically looking or you don't know what Choosing Wisely Canada is, you might not see this, you might gloss over it. Here's a little, I guess, a little introduction to the life of a medical student. Here's a picture of my schedule that I took. This was back last year when we were in our respiratory module. And so I had highlighted here the orientation lecture. So we had just finished our exam that morning. And you can see the whole host of different documents that get attached. And that there is the Choosing Wisely Canada recommendations. So we're happy that they're there. We, in fact, had emailed them to ask to make sure that they are there. But you can see that it can be easy to, miss that in the whole host of lectures that there are, the tons of different different documents that are attached to things. And additionally, when the focus is on, say, in exams, if the focus is on not necessarily choosing the wisest option, but choosing an option that is correct, you can see how medical students, it's smart to study what you need to be successful on exams. So we're hoping that we can kind of get more integration whereby it is incentivized to study these and really know these well. And now I'm going to talk a little bit about Choosing Wisely USask. So this is our student group at the University of Saskatchewan College of Medicine. And so this is, when I was talking about our STARS project, this is essentially our STARS project. Everything that we do through this group, it's a group created by students for medical students. And this year, both Vivian and I are presidents of the group. Last year, I was the first year rep and Vivian was the event coordinator. And we're very excited to have taken on the group and been able to implement some new changes and continue on the hard work of Jessica and Jaden from last year. So our goal, as mentioned before, is to get medical students familiar with Choosing Wisely Canada guidelines. I find that oftentimes when you're talking to first-year medical students particularly, they're kind of like, choosing wisely what? Like, what do you mean? And you can kind of see why, without knowing what this is, the name doesn't really give it away. Even myself, when I first joined the group, the reason I was interested is I saw the name and I was like, I better go ask them what that is because I've got no clue. So in some ways it drives interest. In other ways, you can see how it would be glossed over. So we host different things like trivia nights. We join up to do a blood drive. We do clinical case lunch and learns or lunch talks. We have a social media presence, that curricular integration like I was talking about before. We're present at the panel interviews for incoming medical students. And this year, something that we're pioneering is joining along with skills nights or simulations to combine both Choosing Wisely guidelines with hands-on experiences, hoping that gets people out to the event and excited to learn more. And so talking more about what we do and everything like that, I'll begin with the trivia events. So we hold several different trivia events. This is one of the big things that we like to do. It's often well received. And we do these both in person and virtually. Like Vivian had mentioned before, we have two campuses. So we have the Saskatoon campus and the Regina campus. Both are through U of S. But we have about 60 students in Saskatoon and 40 students in Regina every year. And so we like to do virtual events to make sure that those Regina students get involved as well. And Ali, who is our Regina representative, does a wonderful job at making sure the Regina students get involved and also get the pizza and prizes from trivia events. So here's an example of an event that we held with CAPC, which is the pharmacy resource stewardship group here at USask. This is something that we do annually every year during the week of Antimicrobial Awareness Week. So that's in November. Pharmacy students and medical students alike come out and compete, and we have fun little prizes like these microbe stuffies for winning teams. So it's quite exciting. This year, that CAPC Trivia Night, we had 15 pharmacy and medical students come out to compete that we held on February 28th. Additionally, we have our virtual events here. So here I have attached a screenshot of some of our stories on Instagram where you can make a little trivia, basically quiz that people can go and select. And we tally those up. We see who clicked the right answer and look through, and we would do a draw randomly from those correct answers for prizes as well. These virtual events tend to be very well attended. Something that I think all medical students, speaking with STARS students across the board during our STARS meetings, kind of suffer from is a lot of event fatigue. There are a lot of medical students and a lot of medical groups who are constantly holding events. And so it can be hard, particularly for purely informational events like lunch talks, to get a lot of involvement. So this is something where, you know, maybe somebody has a clinical course that day, they can't come out, but they can still participate on Instagram. So we find that's quite successful. We do enjoy these virtual events. This one in particular, in November, we had about 40 people per day participating and over 100 views per day, which is wonderful. We were very pleased.
I'm just going to chat a bit more about our online presence and why we're kind of using that. So we found Instagram to be kind of the social media site that I think attracts the most students. It seems to be something that most students use personally anyway, so it's not too difficult to just follow another account and hopefully learn something along the way. So this is our Instagram right now. We have Choosing Wisely USask if you want to follow us. We have 264 followers, which is actually pretty good when we talk to other Choosing Wisely groups across the country. We're actually doing pretty well for our online presence. So what we try to do with this Instagram is, like what Kayla mentioned, host these virtual events. And we've found stories to be a really good way of engaging students who are already kind of scrolling on social media. You go through your stories and then a trivia game pops up and you could potentially win a prize with that. So we found to get lots of good views and engagement through using that. And we also use our online presence to raise awareness for events that we're doing, and also sometimes repost things from the Choosing Wisely Canada Instagram as well. So we found it to be a good way to kind of engage the student population in a more passive way. They don't really have to think about seeking out Choosing Wisely Canada. It's just something that pops up regularly on their feed. So we found that to be pretty successful. And this is something that we didn't do this year, but something that the Choosing Wisely student group has historically done, like other student groups on campus, is host lunch talks and lunch and learns. And these are always a fun time. It's an opportunity for students to show up to a lunch talk on a topic that maybe they're interested in, and often have an opportunity to get fed, which always kind of drives attendance up a little bit. But last year when Kayla and I were in our first year, the Choosing Wisely student group put on a lunch talk called Choosing Blood Wisely. And this was with Dr. Prokopchuk Gauk. I hope I didn't butcher that. But that was a really well-attended, good lunch talk, and something, and we hope to do more lunch talks like this in the future. So other points of interest that we might kind of suggest to the future stars at USask is something like Choosing Wisely in rheumatology, or using point of care ultrasound as well, and how that can be integrated into clinical skills too. Another event that Kayla and I piloted this year through our involvement with Choosing Wisely USask was a Kahoot Cases lunch. And this was something that Kayla and I are really excited about because we wanted to focus more on interactive events through our work with Choosing Wisely USask this year, because lunch talks, as I mentioned, are really great opportunities to involve students and support learning, but that's something a lot of student groups do here at the University of Saskatchewan as well. So we wanted to try something a little bit different that other student groups aren't doing all the time, to see if we got more engagement through the students, or if having something interactive was better attended or better received. And I think this worked out quite well. I think it was really a lot of fun. So we used Kahoot for this, and we had students show up, and we tried to gear the cases that Kayla and I wrote towards content that was being currently covered for first year and for second year medical students. We hoped that having this as an opportunity to review some of that content would kind of appeal to students. And we also had snacks available and prizes too, which also helps. But we wanted to allow students to kind of review and look at the content they were learning in foundations in a Choosing Wisely light. So we tried to integrate Choosing Wisely recommendations into clinical management in these cases, just to help students think about how they might potentially use Choosing Wisely recommendations in a real life clinical setting. So it was a lot of fun. I think we got about 20 people who joined in, and I think it was well received. It was a lot of fun. Another thing that we've done this year and last year as well is have a blood drive, and we've partnered with the Canadian Blood Services. And this year we were able to get 20 students out to donate, which was great. And we'd had donation sites both at Regina and at Saskatoon as well. So we had about 20 students through both sites come out and spend their time and donate. And that was people really enjoy having that opportunity and that event. And it's something that people look forward to as well, which is good.
And now I'm going to talk about another new event that we're pioneering. and that is that simulation and skills night. This is coming April 18th, so it's all in the works. It's all planned out. Very excited for it. This is in partnership with the University of Saskatchewan Ultrasound Group, which is another group that I had, the Emergency Medicine Interest Group, and the Anesthesia Interest Group. And the goal here is to have students doing some hands-on things like putting in IVs, doing intubations, simulations of, say, anaphylaxis or imaging, and partnering those with Choosing Wisely recommendations. For example, for our IV station, we're going to be showing the students the IVs, but we're also going to be mentioning like when is a good indication for doing blood transfusion. If you can just transfuse one thing of packed red blood cells and not two, which might be the standard, you can save people from the risk of fluid overload. And, you know, thinking about each blood transfusion as essentially a liquid organ donor transplant, you can minimize the risk of an adverse reaction there as well. So we're hoping that by having these hands-on skills, which tend to always be well received, and partnering those with the Choosing Wisely guidelines, rather than having them just all in a document together, these would help people remember them, kind of be a source of, you know, recall next time they're doing an intubation or next time they're doing an IV. They're like, oh yeah, this is why I should be doing this. So we're very excited to see how this event turns out. Here you can see just our CLRC, our Clinical Learning Resource Center, and so that's where we're going to be holding the event here. All the kind of fake hospital beds and things, it's hopefully going to be a good time. And now again, I had talked about this already, but our curricular integration. So we had been reaching out to module directors to try and get the Choosing Wisely Canada recommendations for each subspecialty attached to that subspecialty's introduction lecture. Right now, we have those attached to the respirology, obs-gyne or reproductive health, and musculoskeletal modules. This is less than last year. And the reason why we think this is our class, the class of 2026, had undergone a curricular revamp. So we're the first year that they kind of switched everything up. They switched the order of our modules. They've changed everything. Right now, we're in a new module that has never been done before. And as a result, we had change in module directors and communications there. So we're hoping that next year, and we've been working with the module directors to try and ensure that they are up to date with what we were doing and hopefully get those Choosing Wisely recommendations once again up. And if they were never up, then get them up in the first place. Okay, and again, the panel interview day, this was March 23rd, so it was a Saturday. So this is the second interview session that incoming prospective students have when hoping to attend the University of Saskatchewan Medical School. Different student groups are invited to set up a booth just to demonstrate what we do on an extracurricular side outside of the medical education that people are going to be receiving. And so we were there and we were explaining to students, you know, what Choosing Wisely Canada is and what we do as a group to hopefully recruit some new members who are interested, but also just explain to many other people so that they weren't like me and asking, you know, Choosing Wisely what? They now know Choosing Wisely Canada, or at least have a familiarity with it and what we do. And so we're hoping that once they release in May, I think it's May 13th or something like that, when they release these new students who's going to be coming, that we have a more interest in the group and more awareness overall. Finally, some more steps in the right direction. So Jessica, so the picture you guys saw a while back in Toronto, she is working with Jason right now to implement Choosing Wisely Canada principles on ID badges. She has family medicine badges that she passed out to the third year students. So they're in their clerkship, which means they're entirely in the hospital pretty much. And it essentially is just all those recommendations right there on their badge that they can go and look towards if they ever need. And I think she has mentioned to me that they're getting to the stage where they're going to be sending out surveys to see how the use was and what people liked about them, any improvements. So we're excited to hear back. Yes, very soon. Wonderful. We're excited to hear how that has all worked out, and hopefully there can be expansion to other subspecialties as well, get all of those recommendations out there. We are, again, working on more collaborative events with other groups, hoping to increase exposure to Choosing Wisely USask and allow for more hands-on experiences, so something that's different from what many other groups offer. We are compiling a list of potential interested speakers for the year to come so that we could do more of those lunch talks. And finally, we're looking for a faculty or resident advisor. This is something that many other STAR students mention that they have at their schools, and it tends to be a physician who has personal interest, physician or resident who has personal interest in the Choosing Wisely Canada initiative and has reached out to the students saying, you know, I'm going to help you out. I'll do some lunch talks for you. I'll do this and that. And so this is something that unfortunately USask does not have yet. And we're hoping that in the future, this can be us, Vivian and I. But right now, we're hoping that for our next year students, we can find somebody who would be willing to take on a bit of a lead there and offer some resources or like personal anecdotes here for Saskatchewan. So fingers crossed, we get some interest there. And of course, looking forward to being that in the future too. And that's what we have for you guys today. Thank you so much, Jason and everyone else who came out. We much appreciate the opportunity to speak here and your interest, and we certainly welcome any questions.